Oxygen therapy, NMC OSCE SKILL STATIon, time limit 10 minutes. Usually, scenario will be a patient requires oxygen administration by using reservoir mask with oxygen supply of 15 liters per minute. Target saturation and current observations will be provided. Step 1. Do the pre-checks. First one is scene safety. Make sure the scene is safe for you to enter into the patient's room and verbalize that the scene is safe for you to enter. Next is privacy. Provide privacy to the patient before doing any procedure. Then do hand hygiene according to WHO guidelines. Next, introduce yourself to the patient. For example, my name is X. I am a nurse working in this hospital. Now I came to do the oxygen administration as per your doctor's order. Then check the patient's ID, that is 3 checks. First, ask the name and date of birth and match it with the record. Then check patient's ID band. Read the name and date of birth from the ID band and match it with the record. Third, ask the patient whether the patient have any allergies or look for the red band. Then quickly explain procedure and purpose to the patient and ask permission to continue the procedure. After that, give call bell education to patient and go to prepare your articles. Step 2. Read prescription. Before administering any prescribed drug, look at the person's prescription chart and check that all of the following are correct. Make sure you read the prescription louder or audible to the assessor and correctly check the following. Patient name, date of birth, target saturation, device and flow rate, date and time of administration, check for any allergies. Next, you have to check the validity of the prescription. Make sure that the prescriber's signature is present and the prescription is clear and legible. After checking the validity, verbalize that the prescription is valid and I am happy to continue the procedure. If any of these pieces of information is missing or the prescription is unclear or illegible, the nurse should not proceed with administration and should consult the prescriber. Step 4. Prepare articles and patient. First one is hand hygiene. Do hand hygiene according to WHO guidelines. Then make sure the patient is comfort. Provide comfortable position to the patient. Semi-follows will be the most suitable for oxygen administration. Next, you have to identify the correct mask. That will be reservoir mask. Once you find it, check the expiry date and verbalize that the mask is within date. After that, take out the tubings and mask from the packet and connect the tubing to the oxygen flow meter. After connecting the tubing to the flow meter, turn on the oxygen flow meter and select the correct flow rate of oxygen, that is 15 liters per minute for the reservoir mask. After connected the oxygen tubing and adjusted the oxygen flow rate, cover the one-way valve of oxygen mask with fingers until the reservoir bag is fully inflated. Make sure you wear glove or use a sanitizer before touching inner part of the oxygen mask. Once the reservoir bag is fully inflated, apply the oxygen mask by placing over the patient's nose and mouth, then pulls the elastic strap over the head. Adjust the nose brace and straps on both sides to secure the mask in a position that seals the face, but make sure it is not too tight for the patient. Ensure that the chosen delivery method is comfortable for the patient. And finally, sign and date the drug administration record.